In the last module, we discussed two different types of prenatal care, comparing the midwifery model to the medical model. Now, it is very important to understand not only the differences between the two types of models and the types of care you would receive, but also what your labor and management of labor would look like if you were to be under the care of each of these models. Now I'm going to compare two things. So active management of labor and a physiological birth. So if you are under an OBGYN, you're giving birth at a hospital, you will likely have active management of labor. This means that your labor will be managed by the physician. If you're giving birth, let's say at home or generally under the care of a midwife, you will have more flexibility in your labor, not necessarily being managed, but more based off of your intuition and how you're feeling. This would be a physiological birth where you're not managing your labor unless medically necessary. So let's talk through what each of those would look like side by side. Within a labor that is actively managed, so within a hospital, it is going to be physician managed, like I said. So the physician will be actively managing your labor, whereas in a physiological birth, so just letting your body do its thing, likely under the care of a midwife, would be really managed by the parent or just completely unassisted. So that means that the midwife is pretty hands off, but really the parent or the mom is the one managing the labor. For active management of labor, you will likely it's a possibility that you will be induced in this type of scenario. So you may or may not be induced to start the onset of your labor. And within a physiological birth, it would be a spontaneous onset of labor. So you will likely not have someone starting your labor for you. You will wait until labor kicks in on its own. Within the active management of labor category, you may be restricted to your bed or to certain positions as far as when you're laboring and more specifically when you're pushing. In a physiological birth, you will not have typically medications or any sort of anything restricting you, so you will have more freedom of movement. Within the active management of labor, you would have an IV. So you will have an IV for fluids at the hospital. This is generally it's more of a precautionary thing for if you were to need a C-section, but it is something that is done in a hospital setting, is that you will have a routine IV put in when you get to the hospital. For a physiological birth, there'll be no needle insertions. Again, you'll be free to move and you will not have any sort of IVs or needles. Active management of labor. So again, in the hospital setting, you will have continuous electronic fetal monitoring. So this is that monitor you'll see over the mom's belly that is continuously monitoring the baby's heartbeat and your contractions. So this will be something you'll have on for the duration of your labor. Within a physiological birth, you will have some sort of a monitoring of the baby, but it will be done via a Doppler. You also can typically decline this. I know most moms will not have any sort of issue with having their baby's heart rate checked throughout their labor, but it would be done manually with a Doppler. And that's even possible to do if you are laboring in water. Your midwife will have a Doppler that will work in a water setting. Within that active management of labor, you'll be restricted as far as what you can eat. I know typically in a hospital setting, you will not be able to eat food during labor. or they will tell you you can't eat food during labor. I think you can generally have water, or they'll provide ice chips for you to have during labor. While in a physiological birth, especially if you are at home, you're free to eat whatever you want, eat and drink throughout your labor as you want. I know a lot of women don't want to eat when they're in labor because they don't feel like it, but you have that option if you want to. Within active management of labor or in a hospital setting, a lot of times you will at least be offered, you will always be offered actually an epidural in a hospital setting. It is very routine to do an epidural and to have some sort of medicalized pain management throughout your labor. In a physiological birth, you will use more of natural relaxation techniques, which I will cover in this birth course in a later module, but it will be different types of natural relaxation. Sometimes your midwife, most of the time your midwife will have some sort of pain management for you, but a lot of times it will be just natural things such as hip squeezes by your doula or your partner. Within the hospital setting or in active management of labor, you will have coached pushing, unless you choose, if it's a part of your birth plan that you do not want this, but coached pushing is a part of that. So what I mean by that is you will have a physician or doctor, your OBGYN, telling you when to push, especially if you have an epidural. You will not be able to feel the sensations and know when to push your baby out. You do still have naturally that fetal ejection reflex, but you will not know when to push. So you will have someone coaching you through pushing. I kind of already mentioned it, but in a physiological birth, if you are, especially you're going to be unmedicated in this situation, you will not have someone coaching you to push unless there's a reason. There's definitely a time and place for a provider to be telling you, okay, it's time to actually try to actively push your baby out, but you'll be waiting for that natural fetal ejection reflex to kick in. Within a hospital setting, typically you will have immediate cord clamping, which means when the baby comes out, they will clamp the cord, to be able to cut the cord after the baby is born. And in a physiological birth, typically the cord is delayed to be clamped, so delayed cord clamping, and it will be cut later once the cord has stopped pulsating, once it has turned white and all the blood from the baby's from the placenta has entered into the baby. As far as where you'll give birth, typically in a hospital setting, it's more common to have a land birth. So there are hospitals that will allow a water birth. I think it is pretty rare for that to be an option. But within a physiological birth setting, which is generally done at home again or at a birth center, you will be able to give birth in whatever position, in wherever you want, whether it's the shower, the tub. Generally, midwives that are like a home birth midwife, for example, and midwives in general, are more comfortable and familiar with you pushing the baby out and the baby being born in different various positions, and specifically when it comes to water. So you have a little bit more freedom when it comes to how you actually want to birth your baby. So these are just some of the things to consider when you do give birth in a hospital. It doesn't mean that things can't be done in a physiological way. It is 100% possible for you to have a unmedicated physiological birth in a hospital setting. But as far as the standard practices and what is typically done within a hospital birth setting versus either birth center or a home birth under the care of a midwife will look different as far as how they fundamentally will help you or kind of hands off help you throughout your labor. So it's really important to ask your provider questions. Ask them questions. If you have an idea in your mind of what you want for your birth, let's say that you really just want to avoid a C-section, you know that that is not something that you would like to have happen. That will create a burden for you. If you have a C-section, you can ask your provider, what is your C-section rate? If it's something that you don't really want to have an epidural and you would really, really like to try to do it without pain medications and do those natural pain relieving techniques that I mentioned, or I mentioned one of them, the hip squeezing, you can ask them, what is your epidural rate? That will give you an idea of, does my provider feel more comfortable with doing things a certain way? Are they more likely to pressure me to do something? You can absolutely talk to your provider about those things so you can get an idea of what your experience would be like. I think even as a first-time mom, we have a intuition about certain things, and our intuition comes from the Holy Spirit. And that intuition and wisdom is something that we really should not be drowning out. And I say that because just because something is routine, let's say your provider does something that is routine in the hospital setting, does not mean that it's how it has to be for you. Going along with the different types of managing labor comes with different protocols, different things that have to be done in certain types of situations. And I'm bringing this up as an important truth for you to understand. And that is, anytime that you are tampering with the physiological process of labor, and you are having someone manage your labor, you are creating somewhat of a risk for things to happen. And what I mean by that is, anytime you do put in a pharmaceutical drug, for example, even something like Pitocin or an epidural, this is changing the physiological process of labor. And going back to that intuition, I think there's a reason why a lot of women, in their minds, they think, I would love to do it naturally. I would love to just not have pain medications. And I think that that is that voice, the Holy Spirit guiding you to tell you it's possible to do that. You don't need to be medicated. And this is going back to that truth. The important truth is that there are risks to being medicated while you're in labor. So it's always your choice as far as how you want to do things. But do your research, really understand what is the common thing or common things that are done within the hospital that I'm going to be giving birth at. What are the common things that my midwife does? What can I expect? And most importantly, do not brush off your intuition. Trust those instincts. Make decisions that are educated, that are going to give you the experience that is going to be the most enjoyable experience, a blessing for you, and not full of burdens.